I wanted to talk to you today about Kira Bell, who was a 23-year-old woman who was treated with hormone blockers to prevent the onset of puberty as a teenager. And she is now launching a legal battle against the NHS because she's saying she should have been told to wait. Now, at the age of 15, Kira began to identify as a boy. She says that the specialised child gender clinic in London's Tavistock Centre steered her towards taking medication that resulted in her receiving hormone blockers after roughly 3 sessions. Now, an internal review that was conducted at the Tavistock Centre in 2005 found that clinicians felt that they had been put under pressure to refer patients to gender transitioning pathways much too quickly. And then a further investigation that happened last year showed that clinicians also had concerns about child protection, safeguarding, but they said that these concerns were just shut down. Now, after 8 years, and after undergoing surgery, Kira is detransitioning and she is now again identifying as a woman. So my question to you ladies is, do you think that children should be given hormone blockers? And do you think that a child can truly give informed consent about taking treatment that delays puberty and puts them on the path to start transitioning?
I hope that what happened to Kira doesn't happen again to any child ever. Yeah. I mean, you just said, Sophie, she had 3 sessions. 3.
Roughly.
And for anyone that does,
3 sessions. That's the
and also, in terms of time, though, the sessions were roughly an hour each. That is not enough. That is just not enough.
Not.
But at the same time, another thing that I don't want to happen is for people to use this very public story to discredit trans children and their gender identity, because I do believe that every person deserves to have their gender identity recognized and respected, no matter what their age is. For me, allowing a child to express their gender identity is a no-brainer, but allowing a child to permanently change their pre-pubescent body, that requires, you know, a couple more layers of thought. And I don't even say that lightly, because I know that these transitions have saved lives. I know that these transitions have prevented so much suicide. And I know that in terms of statistics, the children who regret their transitions are less than 1%. So I'm not, you know, unaware of all of those things. I do just think that we need to have a different alternative. And I think that in terms of our society, we can do this in the long term, but in terms of the children's households, this needs to be done immediately. And I really believe that we need to just deconstruct gender, because we have gendered skill sets and personality traits, and we have gendered jobs. We need to allow people to like whatever clothes that they like and whatever colors that they like, but we have gendered clothes and colors as well. We have related, you know, femininity purely to womanhood and masculinity purely to manhood. And these are the kind of things that mess with, like, say, maybe like a young girl who doesn't feel in the slightest bit feminine might feel like she is not allowed to identify as a woman. And Kira said herself that, you know, she doesn't know what could have happened, but she believes that if she was more accepted by society, if she was allowed to be who she was back then she probably wouldn't have gone down this path. And so, like I said, as a society, but also for the children in the household, because I know that they go through therapy, they need to also do that with the family as a whole, I think.
Yeah, I think I definitely agree with, I guess, most parts of what you're saying, Luanda. I think there definitely has to be layers when you start to think about children making permanent decisions over their lives. And for me, it's almost like I feel almost not well versed enough to even really have a valuable contribution, because I'm not somebody who has struggled with my gender identity. I'm not raising a child, and I'm not raising a child who is also struggling with their gender identity. So I can't say what's right for a child to do. Like, do you know what I mean? And when I was reading the Kira Bell story, there was another woman in the lawsuit, but they were referring to her as Mum A, and she was talking about how she the basis of it was just like this decision was happening and she wasn't sure if this was the right decision for her child, but it was almost a decision for her that she couldn't make, basically. Like, it was the child and the doctors and the medical profession institute, whatever they're called. Yeah, there we go, professionals. I was like, institution, body. It was almost like she was almost left out of it. And it's so difficult because for me, I feel like everybody should live their truth. But then I say that, but with children, I feel like they have to live their truth, but under stewardship, if that makes any sense. So yeah, I would never encourage a child. I would never encourage a child to make a permanent decision as a child. I just wouldn't. I think for me personally, 16, I feel like is of age when you're stepping into young adulthood to start to make decisions for yourself. But under 16, I wouldn't encourage a young child. I wouldn't encourage anybody under 16 to make any permanent decision. And I'm not just talking specifically about gender reassignment, but it could be about getting a tattoo or having a kid or whatever it is. I would just tell them not to make that decision so young, because life experience and knowledge and things, it's you don't get that all when you're young, and so it's a pretty tough. So I think if you're 16 and over, then if you would like to go on the blockers and things like that, then that's what you should do. That's your prerogative. But I think under 16, it has to be considered. I think a lot more consideration, a lot more layers needs to go into it. A lot more than 3 sessions needs to go into it if you're making a permanent decision when you're that young.
Yeah, I think. To be honest, guys, I'm kind of on the same page as you, but I'd probably say that I still think that 16 is also too young.
I was going to say the same thing.
Really?
And I think, if I really want to go into this, so I think we need to be very clear about the various stages. So it's the Gender Identity Development Service. So that's called GIDS. That's the one that I think that Kira is the one that's saying that is at fault here. And they have various stages. So the first stage is the assessment, where they would get you in and talk to you. Then they would say that it's reversible treatment, which is the hormone blockers. So to be very clear, the hormone blockers are really just prevent puberty. They don't really make any changes. They kind of stop puberty happening. And hormone blockers are also given to people who might be experiencing puberty too early. So it's not just for people who are transitioning. Now, they're trying to say there are some side effects to it that they don't really know the long-term side effects yet. They don't know how it affects the brain. They don't know how it affects you psychologically, but they say generally everything's reversible. Once you've stopped taking it, puberty should happen as normal if you decide to change your mind. Then they have ones that are like partially irreversible, and those now become the cross-sex hormones, and you can only start taking those from a minimum age of 16 after you've been on the hormone blockers for 12 months, and those will make you develop breast tissue, or they will break your voice, and those can't be reversed. If you grow the breast tissue and your voice breaks, it's irreversible. And then they're talking about a permanent transition, whereas if you have gender reassignment surgery for your genitalia. In terms of the hormone blockers, I think for me, because we don't really know what the long-term effects are, that's why I'd be scared to give it to my child. And I think it's a very fine line, because if my child had body dysmorphia, which I fully believe is a real thing, and they had serious stress and depression and problems fitting into like their social circles at school because they just didn't really feel like they fitted in with their body, then I would want them to have some intensive counseling so we could really explore that before they made a decision that was permanent. And I think for me, I would be comfortable with them starting something at 18, because I'm like, you're an adult, you're at the minimum age of an adult, but you're an adult, because there are other decisions for me that we wouldn't allow children to make. We're not going to allow a child to say that they don't want to go to school because they don't think it's the best thing for them and they're 11 or 12. We're not going to say they're going to decide to eat whatever they want to eat because they know best and they know themselves best. We were saying just on last week's episode, Luanda said, I wouldn't date guys that I dated 2 years ago. Me too. Like, there's guys that I dated 5-6 years ago that I wouldn't date again. But then we want a child who's like 9 or 10 to make a decision about starting
the rest of their life.
That affects their life, and we don't know the long-term effects. I'm like, a child for me cannot make that decision. They can have the feelings, but I'm like, I can't, as a parent, I have to step in and make some of these decisions until you're old enough. And then when you're at 18, then it's your decision, and hopefully we've instilled you. But even then, as an 18-year-old, even then, we would say there's decisions that we made at 18, and I would hate to think if I made a decision for myself at 18 that I would have to carry on for the rest of my life. Because I'd have been like, looking now at 33, it probably would have been the wrong decision. It probably would have been
Yeah. I think also just what you said about hormone blockers, Sophie, just for anyone that doesn't know, what they say about them is that they don't know the long-term effects that it has on a developing brain. Okay, and so I agree with you in terms of, because you said you don't know the long-term effects that it has on a developing brain, why are we giving this to developing people? It doesn't make sense to me. And it's frustrating because I kind of feel like on this topic, I feel like I have some sort of like cognitive dissonance when I want to, like I said, I believe that everyone's gender identity should be respected. And if I had a child who identified with a gender that was opposite to their sex, I'd allow them to live in that truth. But I don't think that I would allow them to do anything permanent before the age of 18. Yeah. And that makes me question, you know, how much do I then respect the identity if I'm not allowing you to do anything permanent towards it? Because I wouldn't question for a second, you know, if you're telling me that you're a woman, I'll treat you as a woman. If you're telling me you're non-binary, that's fine. It doesn't matter. But then if you're saying that I want to permanently change my body, I'm not on board. In terms of Kira's case, though, I do want to say, because Anissa, you were like, oh, this happened after like 3 sessions of, like we've all said, but her case is rare, and not just in terms of the fact that she regrets it, but in terms of the process. This doesn't happen to most of the kids that are in that situation. There is a really, really long process where they look at your family life and your school life, and if you're going to harm yourself, and you have ongoing therapy, and even the hormone blockers is a part of making sure that these kids make the right decisions, because they will be asked, we can pause this so you have more time to think, so that they don't rush into these decisions. And I think the reason why this happened to Kira is because the number of children who are experiencing gender dysphoria is rising. And I think not that, actually, let me rephrase that, because I believe that they're more comfortable talking about it now. Like, I don't think it's a new thing. It's a new thing that's being openly talked about, and that's changing. And so there was a doctor who worked for GIDS and said in 2005 they were experiencing referrals in the tens per year, but by 2015 they were experiencing referrals in the thousands. And so I feel like sometimes the more something expands, the more opportunity there is for mishaps. The only issue is with something as serious and as permanent as gender reassignment, I don't think there's room for mistakes, because
but look, let's be clear, we're not talking about gender reassignment, because a lot, like, we're not talking about gender reassignment because we are talking specifically about the hormone blockers, because gender reassignment is not something that you could have under the age of 18. Like, that would be something that they would have to be make as a consenting
But you know how you just said that with the hormone blockers, that's reversible, but then you go to the cross-sex hormones, which isn't. And that starts at 16. So they're saying the kids that have done that process, the regret is like less than 1%. And most of them have had like a thorough process, because, you know, I've seen interviews of adults who went through that situation. They were like, they asked me so many times, we did all this therapy, we did this and that. So that's what I mean by when I say her case is rare. But for me, as soon as you're doing something that's irreversible, that is reassignment, because you're
I think it's tough as well, because one of the nurses who used to work at GIDS, as far as I'm aware, she was saying she thought that starting the hormone blockers at 16 was too young. But now we're giving them to 10-year-olds. There's 10-year-olds who are taking it. And 10-year-olds, 9-year-olds. And then by the time they get to 16, they're doing something that is going to break their voice irreversibly. And I think that just really concerns me. But I think on the flip side as well, I don't know if you guys have heard of Nikki Tutorials. She's a makeup vlogger.
Yes, I think I have. Yeah.
Nikki DeJager. So she came out, I think at the beginning of last year, revealing that she's actually trans. And she passes, which means that you wouldn't really know that she was born in the body with male genitalia. Let me say that. And she started the hormone blockers before 14. Then she started the cross-sex ones, and then she said she fully transitioned by the age of 19. And the fact that she was able, this is what makes it so difficult for me, is because the fact that she transitioned or began the transitioning process so early means that she probably looks more like the identity that she identifies with, because she didn't go through puberty, because it was paused. Whereas if you have a man who is, born with male genitalia, but feels like they identify as a woman, and they go through the puberty process and they don't have any blockers, you are not really going to be able to wind back the physical appearance the way you would if they started it before. So, and the people who present as the genitalia that they were born with rather than the one that they now identify with, if they don't match how they feel and how they look, they're going to get more abuse. They're in more danger.
It's so true.
And there's this big thing about passing. So it's kind of like, and this is what made it so difficult, because I'm like, I would want to protect my child from making a lifelong decision and to say, make it when you're an adult. But what about by the time they've gotten to an adult, they're like, now I look like a woman and my breasts have developed, and all of this stuff might not have happened if you'd have just allowed me to take the hormone blockers, and now I'm going to have maybe surgeries that I didn't need to have if you'd just taken me seriously when I'd have said it when I was younger. And I think it's just so difficult as an adult in general to make a decision that's best for children in general. Every parent that I've known has like, you do the best you can. You make the best decision that you can. So that's
why I agreed with you and said it was so tough, because it's like, as a parent, where do you step in? Like, if your child is telling you, this is how I feel, this is me, you want to respect that, nourish that and not stifle that, so they're, so they don't feel lost or resent you or whatever the case may be.
Yeah.
But then at the same time, you have to almost be an adult and be like, but you're still a child going through childhood, so I need to have some level of control here. And that's why I said earlier on, it's so difficult for me to even have a valuable contribution to this discussion, because this isn't something I've experienced, so I can't say for sure what's the best way to handle it. I think everyone, as you said, Sophie, you just have to do the best you can and hope that's what it is. But that's why I kind of said 16 as well for younger, because I know 16 you probably wouldn't want to make any lifelong decision, but 16, you start to step into your young adulthood, you start trying to make more balanced decisions, and maybe at 16
do you know what, I agree with you to a certain extent, because obviously in the UK that is the age to have sex is 16,
and
you can get married with your parents' consent.
You can, but how many people actually look back at having sex on 16 and were like, that was completely the right decision?
Do you know what I mean?
It's tough.
But for me, I'd say 16. That was
right. That's interesting, because I do believe that we should lower the voting age to 16, and I've always believed that. And I believe that since I was 16.
You can make decisions to break your voice or to grow breast tissue that wasn't there by having hormone blockers, but you can't vote. It's just
it don't make sense.
It doesn't really make sense to me. But like we said, we're not experts on this subject, and anyone who is transitioning, we completely respect your decision and your right and your ability to affirm your identity.